important thing is on Tuesday morning, I woke up with a lump on my neck.
Big, like
Golf ball.
Hey, I'm Tom.
And I'm Andy.
And this is On the Node, a podcast about two best mates and one cancer journey. Andy, how are you, mate?
Yeah, I'm pretty good. I'm at the end of my second chemo cycle of 2025, so my energy level's pretty good. My bloods are looking pretty good. So
ready for a big night out?
Why, I wish. Bracing ourselves for a really heavy dose of drugs instead on Thursday with my
not those kind.
Not those kind. No, my third round of chemotherapy. So ready for that. Won't be a fun few days, but got to get through it. Got to be 100%. Done. So.
But you've had a nice weekend, right?
Always.
Friday night.
Yeah, dinner out with a couple of friends, and then always.
Happy days. What did you want to chat about in this episode, mate?
Yeah, so as we told the audience last time, we thought it would be best to take a time machine back to November, December 2022 and talk about how I got diagnosed. Found out that I had Hodgkin's lymphoma.
I know we've chatted so much about this, and the question that I always randomly ask myself, okay, what is my earliest memory of my life, right? And you can ask that to all sorts of people, but I suppose it's equally as relevant here in the sense of what is the earliest memory you had of thinking, okay, maybe something's not quite right here?
Yeah, really good question. And essentially, we went on holiday mid to late November for Lan's birthday. We went to Vietnam for a long weekend.
Who's Lan?
Partner and primary caretaker.
Excellent.
Future special guest.
100%.
She's very much looking forward to it and sharing her part of the story. But when we talk about that time, we'd had a weekend away, and on the Monday morning, so I think we landed on Sunday night, 9:30, 10 o'clock. And on Monday morning, I woke up with chest pain. Essentially, when I was breathing in or even laying on my side. I remember waking up about 4 a.m. on the Monday morning in just pain because I sleep on my side. And I had to find out what that was. I just assumed I've had that sort of pain before, just sort of like tight ribs. And I just felt that, this will go away. But by the end of the day, it hadn't gone away at all. So
where was it on your body, or was it just generally chest feeling?
Exactly, yeah. It was just through the ribs on the upper half. I think that's kind of what I remember. But the important thing was that I booked a doctor's appointment for the next morning.
So you're back in Hong Kong at that point?
Correct. Yeah,
on Monday.
On Monday, yeah.
And you booked the doctor's appointment the next day?
Yeah, by Monday afternoon, when the pain was still there, I had already booked an appointment for the next morning.
Question, yeah? Are you someone who, in general, is quite... I actually don't know you about this, but are you someone that's quite on top of things medically? So, historically, have there ever been occasions where you've maybe not gone to a doctor as quickly as you should?
Definitely, but I think the influence of... the COVID years and also Lan as an individual was a bit more on top of things like that and would influence me and my mindset. So I proactively booked it for the next day because it was my first day back at work. I was a bit busy, so I went on Tuesday morning. But the important thing is on Tuesday morning, I woke up with a lump on my neck.
Big, like
golf ball.
And that had just come up overnight.
Yeah. It just literally woke up and it was like, well, this is convenient. I'm going to see a doctor anyway. I'm going to ask about these things. So
when you felt that, what did you think?
Well, as I think we mentioned in episode 1, the challenge with the lymphatic system is that you get those lumps through kind of a cold and flu. And I felt that I probably caught something in Vietnam or on the flight.
Very easy to catch things on a flight to and from Vietnam.
Yeah, maybe, or any other destination.
You'll see here, Tom looks like he's really pleased with this joke, but I realise you guys might not be following. Years ago, Tom came to visit me in Vietnam for a weekend. He landed on Friday night, we went out for a few drinks, and we had a really good time. The next day, he wasn't feeling very well, and to this day, he's absolutely convinced it was ice in his drink on the flight over. I'm not so sure, so I'll leave it to you guys to decide. Anyway, back to the podcast.
The important thing is that I felt that maybe it was a cold and flu, but after these COVID years, I thought I better go get this checked.
Yeah. It was still in the midst of COVID, right?
Kind of. I think for Hong Kong, it was like the tail.
Okay, yeah. November 22. Okay, yeah.
You still had to wear masks. We still had to wear masks.
Yeah.
So that was kind of the start of the investigation, as it were, and I never thought it would lead to where it did. And like I think today we'll talk through how we got there. But essentially, that doctor on that Tuesday morning, he said it was really common for after a flight, generally after a longer flight, rather than the sort of 2 hours I had, to have swollen rib joints. Right. So he prescribed me some anti-inflammatories, and at the same time, he was very cognizant of this swelling in my neck. So
GP?
Yeah, it was a GP. Okay. And he booked me a ultrasound to kind of find out more and investigate that. And that was a few days away at that point in time. So the anti-inflammatories worked. The chest pain went away, but the lump in my neck didn't.
And then, so I've been guilty of this in the past, where you kind of, for instance, big lump in the neck, go to a doctor, tell my parents, probably freak them out a bit. But at that point, had you told anyone, or was this just a kind of story that you and Lan were living at the time?
Yeah, well, we honestly thought it was we thought it was going to be some sort of chest infection or something like fairly insignificant at this point in time. So no, it wasn't something I talked to. I didn't even talk to my boss about it, apart from I need to go to the doctors this morning. I'll be coming in late. That kind of thing. I think what then transpired over kind of the next couple of weeks. I think the Friday of that week, I had
So Tuesday doctor appointment, Friday
of that same week, I had a flu vaccine at work. Like it was a company provided annual flu vaccine, so I went in and had that. The worrying time, and this is when we started to think something's not quite right, is the next morning. This is the Saturday of that same week. I had a rash.
Calendar.
Yeah, I had a rash that was all over my chest and up to my neck. And as that day progressed, that rash went down to my feet, essentially.
So it was a full body.
Yeah, absolutely. So
and that obviously is not a typical reaction to a flu vaccine.
Yeah, people can have allergic reactions, but I've had a flu vaccine for many years and I've never ever reacted. So it was a bit unusual. Obviously, the formula changes each year, so sometimes you do. But we thought combination of lump on the neck and the rash, there's something not quite right. Let's go and follow up. So we went to see various outpatient doctors over the weekend who needed various sort of like insurance approvals, which don't come through on a weekend, to do more tests. So nothing much happened on the Saturday. We did see two doctors. They showed us one rash that was like, oh, this is the type of rash that you should be worried about. The rash you've got, don't worry about that at all. This is just normal. Anyway, so that's very reassuring. When the doctor,
good to know that there are normal rashes.
Yeah, exactly. So it wasn't until the Sunday night that I think we felt we were taken seriously for the first time.
And what was the turning point there?
The turning point was an increasing concern from Lan and somewhat of an impatience for waiting for the various procedures through various outpatient referrals from GPs and stuff, that we just went to A&E. I think it was like 10 or 11 o'clock on Sunday night. The rash was still spreading. I had this lump on my neck, which I think
was it getting bigger?
It split into two.
Right.
2 lumps at that point, or it felt like it split, but it was probably a second
Yeah,
lump
yeah, yeah.
essentially. But at that point, we went to A&E, and yes, it was a long wait, as you hear about any A&E
Yeah, of
service.
course.
Emergency room for any audience in the in the very Western Hemisphere.
Yeah.
But the value that we got out of that experience was it was the first time someone took us seriously.
And how did they react? How did you know that they were taking you seriously?
So once I eventually got
Yeah.
into the emergency room, they drew blood and they did a chest x-ray. And although they didn't get the lab result for a while, the chest x-ray showed something. It
Right.
just x-rays, I think, are fairly sort of based,
Binary.
like when you're looking at sort of soft tissue rather than bone, I think they can't get much detail out of it. That's why you have CT scans and MRI scans, etc. But there was basically this sort of like grey cloud through my chest, and the doctor was like, "Ooh, that's interesting," and they admitted me. And when
Into
they
hospital.
yeah, so even though we'd been to 2 hospitals already,
Yeah.
to to their outpatient clinic, they'd never admitted me based on the rash and the lump. They just said, "Oh, wait, come back next week, get a blood test and stuff." There was a lot of like waiting around. But we went to the public hospital, to their accident emergency department. They did an X-ray and they go, "You need to go in straight away."
And this was on the Sunday.
Sunday night, yeah.
And what are you thinking at this point? Like, not thinking in terms of diagnosis, but what are your feelings?
First of all, probably looking forward to a terrible night's sleep ahead, because I think they didn't have a bed for me, so I was sat in a chair that first
Excellent.
night. But apart
kind
from
of
that,
not.
the hospitals are busy, and the reality is although I had all these symptoms, I felt fine.
Yeah.
Like I didn't feel ill. I wasn't coughing. They see something in my chest, but I wasn't coughing. I didn't have a fever. Well, I didn't feel like I had a fever, but I
Yeah.
think sometimes when they took my temperature, I did have a fever.
Right.
In terms of, but yeah, I think there was a combination of relief that someone was listening to me,
Yeah.
and a little bit of anxiety going, this is actually my first hospital stay in like memory. So I had
yeah.
various other medical conditions when I was a baby, but I don't remember that. So
Wow.
it was my first like hospital stay in memory. I've done outpatients, but that's very different.
And I also, from my perspective, I think it was around that time, that weekend, where you first told me about what you were
Yeah.
going through, that process. So
Ye-
that was the first time that I guess you looped me in. I don't know if you were talking to other friends and family members at the moment, but at that point I was thinking, okay, well, he's just got to go through his test, but obviously I'm sure it's nothing.
Yeah, exactly. That was probably the point. You asked if I told parents and stuff earlier. That was probably the point where we told anyone.
Yeah.
Like it was, had some symptoms for a few days, gone to hospital. They decided to admit me for further tests, and like that was kind of all we know at this time. And people would ask me what symptoms I'd tell them and stuff, but it was all a bit of an unknown at that point in time. Yeah.
So that was the Sunday, right?
Yeah.
Post you landing on the Monday. They gave you an X-ray, they admitted you, they took blood tests.
Oh, they took so many blood tests.
Right.
For the coming.
Did they tell you what they were testing you for?
They were doing like microbiology stuff, like checking for viruses and bacterial growth in the blood. Those kind of tests take time.
Yeah.
Then they did like a full panel for like common, hepatitis and things like that.
Yeah.
I had to sign a consent form twice. They were testing for HIV.
Right.
So that's when you start going, well, they really don't know what it is, but it sounds serious if they think like, oh, that could be an outcome. But yeah, they just there was one day I probably had six blood draws. It was quite
same
intense.
Weekend, or is this now following?
This is
the
in the
following
week following, because I was in for 4 or 5 days.
Okay, so let's talk about that then. So you're in hospital at that point.
Yeah. I'm in the public hospital.
What is your routine through those days?
It was a unusual routine really, because I was in a very busy ward.
Yeah.
I would see a doctor for only a couple of minutes every day, and then throughout that day various nursing staff would sort of come up to me and just sort of take my blood or various other things. I think even at one point, because of the rash, I had a skin biopsy. So a guy came up and basically
Took a little bit out of your skin.
cut a bit of my leg off.
Have you still got the scar?
Probably, yeah.
Where is it?
Yeah, somewhere, I can't remember which leg it is, but yeah, he just sort of came up and did a couple of
Hacked
stitches.
a bit of your calf.
Exactly, yeah. Just literally sat on the hospital bed in the ward, and that was kind of my routine. It was just all very unpredictable, but they wouldn't let me leave the ward.
Yeah.
I was only allowed visitors like during 1 hour a day. As you mentioned, from a hospital perspective, they were still very much going through a COVID protocol.
Yeah.
So any visitors to that hospital had to do a COVID test every day to present it. I was getting tested for COVID every day, even though I was in their hospital.
Like, what?
Yeah, they'd come up to me every day and do a test. So it was quite intense and very hard to get any rest. So
you must have been knackered.
Generally just was so exhausted the whole time because I wasn't really sleeping. So I sort of sat with an iPad watching stuff when I could, and otherwise asleep the rest of the time. And I think I was all on mobile data and stuff. There's no Wi-Fi.
And so you're getting loads of blood tests. Why don't you tell everyone how good you are at blood tests?
I'm the worst. So for people who may experience this themselves, or maybe
I shouldn't laugh by that. I'm not laughing at your expense.
It's fine. I've accepted it. So I go through something called a vasovagal response. I think is what it is.
Syncope at the end, maybe.
Where essentially the body is protecting itself against harm, and so it kind of like your blood pressure drops, and essentially you get very, very close to fainting, or you can faint.
Yeah.
So it's not dangerous in terms of the adrenaline rush and the lower blood pressure that causes you to faint. The danger is falling.
Yeah,
so I've been well aware of this since I lived in Vietnam. So I always tell people when they're drawing my blood, I just need to lay down. And if I lay down, I'd never have this response. So I'm fine in that case.
Nice. So you're going, sounds like they're testing you for absolutely all sorts. How regularly is that feedback loop? Is it kind of like ticking off, okay, fine, you don't have HIV, you don't have this. How?
Almost.
And is there, do you feel like there's an overarching strategic goal, or is it just everyone just randomly testing for different things and you're getting separate updates from different doctors and stuff?
So it was not different doctors. There was one doctor for the ward who I would see every day.
Got it.
And then I think her attending was there as well. Like a senior doctor would come and see me sometimes.
Yeah.
And then they did bring in a tropical disease
consultant.
So I think this is one of the really interesting things. Is there were so many factors that the doctors had to explore, and it was a process of elimination, essentially, as you describe. So there was obviously the rash they had to investigate, the lump on my neck. So I went through, obviously I mentioned the skin biopsy. They also did something called a needle aspiration biopsy.
What on earth is that?
Where
needle aspiration?
Yeah, so you go into a small operating theatre under local anaesthetic, and they put essentially a really large needle into the lump to collect cells, which they can then test.
Is that not a biopsy, or is it different?
Biopsy would be what happened later, where it would be more surgical. But essentially, it's a type of biopsy. Okay. But they use a big needle to extract the cells rather than cutting something out.
I see. Okay.
Also had a vasovagal response during that procedure.
Well, I'm not surprised. I think every single person on this planet getting a massive needle in your neck.
Yeah, I just remember starting to sweat, and then my eyes rolled in the back of my head. So anyway, I recovered from that imminently. So they were investigating all of this stuff, and they were telling us their theories. So as the week progressed and they ticked some of the things off, they did kind of narrow it down to potentially a tropical disease because of my recent travel history to Vietnam.
Yeah.
And they did mention lymphoma, that it was mentioned as a possibility.
Yeah.
But they really didn't know for sure. And the purpose of the needle biopsy was to say, hey, can we get a cancerous cell? But it came back inconclusive at that point in time. So that was quite, we just thought it wasn't that at that time.
So at what point did you really feel like it was transitioning away from random tropical disease to lymphoma?
Oh, well, not yet is the answer to where we're up to. So essentially, we got to a point in the public hospital where I needed to have a PET CT scan.
Okay.
So a PET CT scan is...
Got one of those on Monday, don't you?
I do.
Yeah.
Yeah, in the morning. So the PET CT scan essentially shows medical staff where there are fast growing cells in the
Right.
body, indicative of cancers and things. The challenge with the public hospital, even if I got a privately sponsored one through health insurance, was that they couldn't book me in for like a couple of weeks.
Right.
I think if I waited for the public system, it was going to wait 6 to 8 weeks. If I did it privately through the public hospital, I could get it done in a couple of weeks. So this is where Lan came in as an absolute saint and used her sort of project manager skills to essentially phone every private hospital in Hong Kong, find out who had the machine that could do that test, and we essentially, against medical advice from the public hospital, we pulled me out of that hospital essentially. So I'd been in the public hospital for...
have to sign a...
No, you just sign a
that?
you just tell them, they give you medical advice, and then you just say you just sign the discharge papers, and moved to a private hospital. So I moved to a private hospital in order to do that scan. So I think that was a Friday night, probably early December, mid-December. So there'd been a couple of weeks of investigations. I'd been in and out of that hospital as well, so they did check me out for a while. And they did a PET CT scan, and it was after the PET CT scan where they...
Can you just describe what a PET CT scan is, firstly?
I will do my best. So essentially, they inject you with a radioactive isotope,
right,
which mixed with glucose, I think. Then so that is kind of like just an injection into a cannula in your hand.
Yeah.
And then they leave you for an hour or so for it to spread around your body.
Right.
And then they put you into what I assume is just a regular CT scanner, but it might be a special one. I don't know. I'm not a radiologist. But essentially that scan will light up like a Christmas tree any very active cells in your body. And if I can figure it out in editing, I'll try and get an image to show our audience
that would be a good achievement, given you started editing about 2 days ago.
Yeah, exactly. So we'll give that a go, but no promises, audience. So
no pressure.
Yeah, absolutely. So that scan showed stuff through my chest, essentially. And at that point in time, the doctor in the private hospital said, right, I think it's now one of two things for sure. It's either something called melioidosis, which is a tropical disease. I don't really know much about it because I didn't end up having it.
That would have been...
I know loads more about melioidosis, and this would be the Melioi Bros podcast, but it's not.
Bit of a mouthful, that.
Yeah,
I prefer on the node.
Exactly. So this is where we really narrowed down to it's either that or it's probably lymphoma. So the next step was to do, as you asked earlier, a biopsy, and this is an excisional biopsy where they essentially they sliced open my neck and took a bit of the lymph node out to test it for cancerous cells.
How long does that take? Doesn't sound very long.
Less than an hour, I think. Right. I think it was. Yeah. Well, I've just had another one a month ago, so it's about an hour.
Okay, so they've done that early to mid December.
This is now, we're talking around 19th, 20th of December.
Right. Okay. How long before then it was conclusive?
So they did the excisional biopsy, and immediately as I came out of surgery, he put me on antibiotics because from the surgical inspection, just like a surgeon eyeballing what he took out, they thought it wasn't lymphoma.
Really?
So they put me on antibiotics for melioidosis.
What? So they just literally just looked at your
They had the
lymph node.
and the theory was at that point in time it wasn't lymphoma.
Right.
This is only I'm talking like a matter of like maybe 12 hours or something. So I think I had the surgery one afternoon, and they put me on the drip that evening. By morning,
drip.
antibiotics. By morning, I developed another rash.
To those antibiotics.
Yeah, so another allergic reaction. So that's now on my sort of potential allergy card, but it might just be lymphoma messing with my immune system. But essentially, over that day, we were waiting for the biopsy results. We were told we were going to get them around 4 o'clock in the afternoon.
Yeah.
But I think they came in around
11 p.m.
11 a.m.
Right, so
much earlier.
And what, given, we're still talking about the diagnosis, not to get into too much detail, because I know there's stuff there that you want to speak about specifically in future episodes, but like describe that.
Well,
describe the process up to the point of the diagnosis.
Yeah, well, honestly, it was the first time I would say I felt ill and like a patient. Because as I mentioned before, throughout this whole process, and I know it's taken about a month, and I had these symptoms. I had a rash from the flu vaccine. I had a lump on my neck.
Yeah.
I never really felt ill. I was sat in these hospital wards thinking, I'm fit and healthy. There's nothing, like, why am I here, really? Like, just get on with it. Tell me what it is. Give me the meds, send me home. But that time, when I had and not to be too graphic, but I had essentially a surgical drain coming out of the wound on my neck. It's all for, to promote greater healing and things. But that's the point where all of a sudden I can't move as freely as I wanted to. I've got a cannula and with a drip in one hand, and I've got a surgical drain in the other, and I'm in a hospital gown, and I felt like a patient, and I felt like I was sick for the first time. Although they weren't necessarily sort of, symptoms of lymphoma. It was just mentally, when you see yourself kind of recovering from the surgery and stuff, and seeing wounds and stitches and bandages on you, that was the first time I thought, oh, this isn't good.
Yeah. And how did the doctor deliver the news?
So this is something that I'm sure we'll explore a lot more in an episode when Lan comes on as a guest. But I'll tell my side of that now, and I can't wait to hear her perspective. It was a very painful moment because essentially, as I mentioned earlier, the doctor had told us that morning that we wouldn't get the results till 4 o'clock in the afternoon.
Yeah.
And he came in a lot earlier. The lab had processed it, and there must have been loads of lymphoma in that sample. It didn't take him very long to test it positive. But essentially, Lan had gone home. She'd been staying with me overnight, and she'd gone home to cook me lunch. She wanted me to have a treat meal because she saw that I looked a bit miserable as a patient in bed, and so Lan's a great chef, great cook. So she'd gone home to make me some like real comfort food and something healthy and things. So she was away. And he came in, and we tried to, and he suggested, hey, can you call Lan? Can you call your partner? And couldn't reach her. She was busy in the kitchen, phone on silent or in another room or something, and just could not, for the life of us, reach her. So he delivered the news when I was on my own. So that was very, obviously it's a very lonely experience. And at the same time, I was really conscious that I know how much Lamb would feel guilty for not picking up that phone call and not being there at the time. So it's the two things. It's like, So there was a lot of that was a challenging moment. And we'll talk about how I felt once the news was delivered in our next episode. But that was how it was delivered. He essentially stood over me, sort of said, "I'm really sorry, but it's lymphoma," and that was it. And he kind of outlined the next few steps, like we need to stage it, we need to introduce. This doctor, by the way, just for context for everyone, he was a respiratory medicine specialist, so he wasn't the right doctor for lymphoma, but because they saw this mass in my chest, they thought, all right, we're going to give him to the respiratory doctor to start with, and then they'll bring in the specialists, other specialists as and when. So he said, yeah, we need to refer you to a hematologist. You'll meet him later today. And that was kind of it. I was just given the news, and I didn't know anything about lymphoma at this point in time. So,
well, look, I think that I learned a hell of a lot over the last. There's stuff there that I didn't even realize, and there's only so much you can really get from WhatsApping. We weren't voice noting as much, and it was more WhatsApps, and I think WhatsApps can always come across as maybe overly positive at times, and it was clear, certainly towards the end, that it was looking increasingly serious. But I think that's probably a good time to end this episode. What's next?
So in our next episode, we're going to talk about how I felt. So when I got that news, what was my instinctive reaction, and feelings around that. And I'm also going to ask you some questions about how you felt as a mate when I told you, because I was keeping you up to date throughout that whole sort of process. As you mentioned, WhatsApp's come across a bit more positive, but when that news dropped, I would love to hear how you felt, what you did, and things like that.
I remember it vividly. But till next time.
Absolutely.
I'm Tom.
And I'm Andy.
And that was On the Node.